6 months, you are in the second trimester, and that's even the last month in the second trimester. So what happened? Why are you actually taking this long to come for antenatal care? Hi guys, welcome to my YouTube channel. My name is Cornelian Amici, and in today's video we are going to be discussing antenatal care, what it is, the importance, and the various antenatal screening tests that every pregnant woman should know about. So if this is your first time coming to my YouTube channel, please subscribe to my YouTube channel, give it a thumbs up, and leave a comment in the comment section. Let's get into what we have for today. So before we start, let me just share with you how I came about this topic I want to discuss. So one day I was in the ward. I was just sitting there, actually not doing much. So I saw this man and a woman come in to register for antenatal care. So the nurse on duty asked them why they were coming today, that today wasn't their clinic day, and told them to come on Tuesday. So before the couple could leave, the nurse asked the woman, how long have you been, and how long in are you? So the woman replied something like kind of 6 months. I had that, and I had to actually raise my head up, because 6 months, you are in the second trimester, and that's even the last month in the second trimester. So what happened? Why are you actually taking this long to come for antenatal care? So it dawned on me that not everybody, like people are not actually aware about how important antenatal care is. So I decided to share and educate people why you as a pregnant woman should go for antenatal care. So the first thing we're going to discuss today is what is antenatal care. Simply, it's just the care that health professionals give or provide to pregnant women. Nothing, there's no big grammar in that sentence. How health care professionals take good care of pregnant women. Simple. What's the importance of antenatal care? Pregnancy could be a risky condition, most especially when you are not properly taken care of or observed adequately by medical personnel. Number one importance is that it helps to prevent unwanted complications during pregnancy. There are a lot of complications that comes with pregnancy. These complications include high blood pressure, stillbirths, miscarriages, preterm labor, and the rest of them. Okay, so with the proper antenatal care, all these complications could be checkmated. So the second importance of antenatal care is that it helps to prevent maternal and child mortality. According to WHO, Nigeria is rated the third highest nation with high maternal and child mortality rates. That is very, very bad. Like, it's increased by 14% as of 2020. So that's really, really bad. It's not a good thing. So with proper antenatal care, we can reduce this mortality rate in the country. Next is that it promotes the health of the mother and the baby. With antenatal care, the medical personnel are ensuring that the mother is healthy, the baby is also healthy. The fourth importance of antenatal care is that it helps to prevent post-delivery complications. Earlier on, I said that it helps to prevent complications during pregnancy. Now, these complications we're talking about now is the complications that can arise or arose or could arise as a result of having given birth. So these post-delivery complications could include high blood pressure, amniotic fluid embolism, anesthesia complications, infections and sepsis, excessive bleeding, cardiomyopathy, or cardiovascular diseases. Now, the fifth one is that it helps to assess the state of the health of the mother and the fetus early in pregnancy. Okay, this is where the medical personnel can detect some issues early on, so that if it's something that could take the life of the mother, they know if they are going to evacuate the pregnancy or not, or something they could monitor to a certain age or to a certain stage and determine if they could induce labor. It's just like making sure that, oh, this is happening, can we handle it? Is it something that could cause the life of the mother, and they'll find a way to prevent it. So having discussed the importance of antenatal care, now let's go over to the essential, like I won't call it the essential, but the normal or the screening tests that should be done during antenatal care. These tests includes the full blood count, infection tests, checking the levels of the vitamin D, genetic disorders test, cell-free fetal DNA sample or test, chronic villus sampling, amniocentesis, and alpha fetoprotein tests. So all these are the screening tests that should be done during the antenatal care period. So having stated the screening test that is required for antenatal care, let's talk about when do you start antenatal care. Now remember, if you can go back, you can remember that I stated in my importance that it helps to assess the health of the mother and the child early in pregnancy. So when you should start your antenatal care should be early in your pregnancy. It shouldn't be second trimester. It should be like 6 weeks to 10 weeks. Like start between your 6 weeks to 10 weeks of pregnancy. That is when you should start your antenatal care, so that anything can be detected, any complication, any deferred, any birth deferred can be detected early on and either managed or handled or probably evacuated if it's going to be at the risk of the mother. So go for your antenatal care. So if you've reached this point in this video, I am super grateful. I really appreciate it. Please don't forget to share this video to first-time pregnant women or even existing pregnant women. Yes, I call them existing because they've been pregnant before but probably didn't go for antenatal care. Maybe there was no complication. Good for them. But now they are pregnant again. We don't want them to repeat the same mistake. So share this video to them so that they can start their antenatal care, so that we can reduce the rate of maternal and child mortality in this country. Thank you very much. Don't forget to subscribe. Also leave a thumbs up and share this video. Love you. See you in my next video.